What have been the results over the last 15 years among the patients that you treated with standard medical care for type 2 diabetes versus the ones you treated with diet and lifestyle?
Well, clearly, in the last 15 years, the one with type 2 diabetes, the diet and lifestyle has proven to be very, very effective. We we routinely wean them off medications. Now, I have a different approach when managing my diabetic patients, my type 2 diabetic patients. First of all, we tend to more loosely control the blood sugar. By that, I mean, I'll tell my patient, if your blood sugars are below 200 milligrams per deciliter on a fasting basis, on a regular basis, then we're good with that. I'll continue to decrease your medications as long as your blood sugar stay below 200 milligrams per deciliter. Now, that doesn't mean that 180 is a good number. It just means that I'm okay with that number, and I'm okay with removing the medications as long as your blood sugars don't go above 200. So that's one. And two, we then are very aggressive in doing interval, back to the so-called interval training from an exercise standpoint. We do interval training from a nutritional standpoint, where we will have individuals go through an intermittent detox periodic. So maybe 2 or 3 years, 2 or 3 times a year, they'll go through a raw detox where it's raw fruits and vegetables only, and for 30 days, and they come off and eat, from 0 to 6. Again, not eating fried or sauteed food, but plant-based with some cooked foods and some raw. And so the intermittent cleanses and detoxes, it does several things. One, it helps the taste buds change. And so it gives them a craving for cleaner and cleaner foods all the time. And two, it sort of jumpstarts, sort of like a bolus intervention to the biochemistry. So the cells heal at a faster rate. And so your body's sort of going to a stair-step process of healing. So healing is a progressive thing. It's not like, okay, eat your plant foods in 30 days, everything's gone. No, these people have been destroying their bodies for decades. And so it's a process over time. That healing is a process over time that's necessary. So we carry them through that process. So now, back to the type 2 diabetics, the individuals who go through that process and are staying on that course, they stay off the medication, the blood sugar stay in good shape, and there's just no problems. There are many patients who are on insulin and other agents, and their numbers remain controlled, and they remain healthy and so on. Sometimes they may regress a little bit, but the way they regress, I have a patient who's 95 years old, and we've been seeing her since she was 89, and she came in with bad arthritis and other issues and diabetes, and she was had been on insulin for 50 years, or no, had been a diabetic for 50 years, on insulin for 40 years, and she got off insulin the first 3 days. Now she's been off insulin since we've been seeing her. Now, does she regress? Yeah, she regressed. How does she regress? Well, I've been eating too much cooked foods lately. That's how she regressed. She does better on raw foods, but sometimes she drifts and eat too much cooked foods, and she feels worse, and so she goes back to more raw. She feels better, and so we work with her in that regard. But our patients just do so much better when that foundation of consumption of natural, healthy food is there. Exercise, fresh air, sunshine, those things are being added. And then you may have drifts here and there that we may have to address things, but that foundation of plant-based diet, I have many examples, patients with chronic lung disease and various other problems who are doing much better than they would be doing otherwise if they were not eating this way.
What do you recommend for someone with eczema?
I don't see a lot of patients with eczema, so I can only recommend removing dairy. A colleague of mine who's a pediatrician sees kids with eczema, and one thing she shares with me that when she removes the dairy from the diet, the eczema goes away. So I would subject to removing animal protein, and particularly being focused on the dairy products.
What about eggs? Are they healthy? What about egg whites?
Yeah, we don't recommend eggs of any type. The yolk. Neil Barnett says, the only 2 problems with the egg, the yolk and the white. So I guess you can take that and run with it. But no, when we've had individuals come and they're only eating eggs and we just remove the eggs, their cholesterol comes down. So we don't recommend eggs in any form, not even the shell.
Why was it important for you to come back and speak with us here at the Real Truth About Health conference?
I think the conference is a great conference. My goodness, you've had all of the superstars at the conference over the years. I've seen the videos online, and it's a very powerful conference. It was the very first conference, in my opinion, was very powerful. I mean, even though it's gotten bigger, I think it was always a great conference from what I can tell. And I think you guys have done a great job at putting on a very informative conference, and you've brought together great minds from different, avenues of the natural healing community. And so, you can only do better, and the world needs more of you. So whatever small amount I can contribute, I'm glad to do that. And so I'm glad to be part of the solution.
And we are grateful that you are, and it's been a privilege to have you today and hear all about what you're up to. So thank you very, very much for your time and for all of your meaningful work.
Well, thanks for having me. It's been a pleasure, and I always enjoy doing this.
Thank you again. Be well.
All right, you too. Thank you.